Are you sure you don't want me to?
No, you're fine. Margaret, you're fine.
If someone else comes, they
You have a spot now, huh? I do right over there, so I can see.
It's 1:30, so I'm calling the meeting to order. And Mike, do you want to do the roll call? Yeah.
Sorry, lost my mute button. Yeah, looks like present today, we have our, both council members are present. Those are police chief, city manager, and assistant city manager. And if you'd like to introduce yourself for the record. Margaret.
Oh, I'm Margaret Slake. I'm the CEO of Reach for Home Northern Sonoma County's homeless and housing service provider.
And Mike, we still have the subcommittee
And-
screen up?
That's why I can't see what's going on. 1 second.
I also represent, while you're doing that, Northern Sonoma County on the Continuum of Care Board, which is now called the Homeless Coalition Board, I think is what they do.
Yeah.
Let me just change your name.
Angie.
Amazing. We still do the same thing.
Hey, David, what are you seeing now? Because I just see a black screen and I'm not sharing anything.
It says, it's a screen, it says the meeting will begin. Oh, okay, here we go. Got it. All right.
Maybe we should-
Yeah, I haven't been sharing my screen for a while, so just load it.
Now,
There we go.
There we go. We're good to go, Mike. Thank you.
Okay, yeah, I'm not sure what happened there, but thanks.
So I'm going to open the meeting up to public comments. It doesn't appear we have any guests, but I'll read this anyway. Members of the public have the right to speak on any item on the agenda in person. Commenters will have 3 minutes to speak. Subcommittee members are not required to respond directly to questions or enter into dialogue with commenters. Pursuant to the Brown Act, the subcommittee is not allowed to consider issues or take action on any item not listed on the agenda. Comments may also be submitted prior to the meeting. Okay, so first thing on the agenda is written communications. Have we received any written communications?
Thank you, Chair. Actually, we did receive one written communication. This was an email from Mr. Dave Kiff. He is the director of the Homeless Services Division of the Department of Health. Today is a county holiday for the county staff, and therefore they are unable to attend. But he did just wanted to provide some information for the subcommittee. They have not released the data yet regarding the point in time count. We're going to provide a little bit of update. Maybe Margaret can fill us in on her observations on how the count went. But the data for the point in time count probably will not be released until the formal tallying process is completed later in the year. That's pretty typical. And he also wanted to convey that the county HEART team, which is part of their homeless outreach and response team, has been up in this area a couple of times in the recent past to visit what's referred to as the Shamrock area. And this is the area that is located just east of the Russian River and the Crocker Bridge. And they've worked and done some collaboration or coordination with the sheriff's department. The approach for the homeless services team is really to get involved with the homeless services providers, a coordinated entry, and to talk, whether there's any housing that might be able to be offered. So that was the just an overview of the email communication that was received in response to sending the agenda and inviting the staff to attend today. Sometimes they have representatives here, but I just wanted to enter the communication to the record. Thank you, Chair.
Would anyone like to make a motion to approve the minutes from June 12, 2023?
Motion to approve.
Second.
New business EA discussion Cloverdale unsheltered encounter statistics.
All right, thank you, Chair Morgenstern. This item on the agenda is in regards to how often our police department has they collect statistics in regards to their interactions with the unhoused population or unsheltered population. And I asked Chief Ferguson to, Chief Parker. He's still with us. To provide an update on the statistics and, any other additional information to and help provide this subcommittee with just an overview of how our police department has responded to the shelter population. So with that, I'll turn it over to Chief Parker.
So I just did a 6 month, how many contacts that we had on the record. With the officers, and we had 176 contacts listed. Just understand, not all of those. I mean, there's probably about 200, but because we sometimes we'll just roll up and say, okay, you need to move, or you can't drink there, whatever, and then we're off. It's just a real quick contact. I asked for how many people of those 176 did we 5150. It was 11.
What was the time frame for this? I'm sorry.
July 1 last year.
Oh, okay.
So this
Of the 11, 5 of them were for Jacob Outlet.
Mhm.
And I know at the time, I know Jacob very well. And we can kind of see when he goes in and he comes out, he changes, right? And then we start sticking those dives and we take him back, on his meds. But I know last year he was really asking for help. And he would tell the officers, hey, I need help, I want help. He was trying. Yeah. He would do everything that I think that's where the 5 came out, where we 5150 them. And one of the officers told me that the doctor said, well, it doesn't meet the criteria, whatever that means, that they didn't really understand what the doctor was saying. And it gets a little frustrating with the officers, because they're in 1 minute, they're out the next. As recently as, when we had the dark park opening, we had taken Fade in, he's right back out.
No, actually.
Is he back again?
Well, he's otherwise detained. I don't know how much I can say in public, in a public
So
meeting.
he's back in, he's doing
We're working to try to get him some resources before he gets out so that he's stable. So
okay.
we still are hoping he's gonna work out, but
oh, nice.
I don't know what I can say in a public meeting. I can have an offline conversation with you.
Yeah.
I don't know where to go.
I got you. And Chief, maybe for benefit the chair, vice chair, and anybody who may watch this meeting in the future. Talk a little bit about when you make an encounter with an individual, what the criteria is or that is utilized by the officer as part of the determining whether they're subject to 5150.
Yeah, so
And what that means.
we're looking to see if they're able to take care of themselves. They're a danger to others. Are they eating correctly? Do they have any medical issues that they're not taking care of that, it's like that? And, we had one, I think it was that, we had, was it the stinger? I think his stinger was like green and time.
So medical conditions suggested that
Yeah.
you need to be taken into further care.
Correct. And the 72-hour is just so that they can get evaluated. A lot of times it's not 72 hours. And they're just, the doctor will evaluate them again to see what they need. And then they'll reach for homes, will step in sometimes and.
Yeah, so if it's someone who's unsheltered, and you 5150 them, and just because I'm new to you and you're to me, what we typically can help with at Reach for Home is if we know they're being 5150, then we know the hospital they're going to, and they're unsheltered, as long as it's not like 3 in the morning or at a time when we're not available, we'll literally go to the hospital and make sure they don't release them, because what will happen is the hospital will, will basically take them in, your officer will drop them off, or they'll go by ambulance, they'll medically clear them, and they're out in like a few hours. So it's like, there's no point. But if we know in advance and we know there's like 3 to 4 people that circulate through here that need the help, they need access, they need crisis stabilization, they need medications. So we're all on the same page of who they are. We'll literally go there. We just hired a director of mental health services. She'll go and she'll literally stand there with the person and advocate for them to get them through that barrier, because otherwise we call it bouncing. They just bounce them. And it does no good it doesn't do any good for anyone. It doesn't do good for taxpayer dollars that cost you to 5150 them. It doesn't do good for them. They're traumatized by having this whole situation occur, and then they're just tossed out again. So it doesn't work all the time. It's not, it's not like you guys know it's not 100%. But it definitely increases the odds that they get some sort of an evaluation, because they won't even mentally evaluate them a lot of times if they're medically stable.
Yeah.
They'll just release them without an eval, and we can at least get them to do the evals usually.
I got a quick question, and this is just, you go through and read Sonoma County Continuum of Care, you read all of this stuff. I can see why some people either don't have the mental capacity to get it. There's pages and pages of you call here, and it's super confusing. So my question is, if I run into somebody or somebody runs into, say down on the river, walking my dog, whatever, just the other day, there was 4 people down there that I didn't recognize. And if I determine, hey, I'm gonna talk to one of these guys and say, hey, and offer them some help, who's my first call? I'm sitting on my cell phone down at the river. I see somebody, who do I call?
You can call reach for them immediately.
Okay,
Yeah, if they
gotcha.
don't already have, we know.
Obviously I
we know
can call
all the people
chief.
here, But yeah, you can also.
I can call chief, but I'm just thinking some of these people, they probably won't qualify or whatever, but I know they need help, and that's where my block is. I come in and I'm like, oh crap. I walk off and get in my truck and go, I think I can help that dude. I just don't know.
Right, yeah, Mayor Lance has my text information.
I have your information too.
Yeah.
So, okay.
We can try to coordinate.
Good, because that was a big question for me, and it's not just down at the river. it's periodic, they closed the Joe Rodota down in Santa Rosa. We're gonna see an influx up here
Mhm.
sometimes.
Right.
But then there's a lot of people around, and that's the question I've been asked also by some people in the community, like, hey, I saw a guy that might need help, who do I call? So Reach for Home, is that the only place, or can I call, is there another, is there another team like that comes up, street team or anything? So you guys kind of are the start, okay, I can do that,
Usually 2 days.
okay.
But we'll come up whenever, like.
Yeah, good to know.
We hear chief say, hey, Jacob's ready, like, okay, we're on our way, like.
Well, and he's one of them too. When you mentioned Jay, I think everybody knows Jacob, and I felt bad for that kid, like, hey, man, you need help, and you don't know if he's getting what you're throwing down for, so.
And the next time the doctor tries to act like he doesn't qualify, I think, is it possible to say, could you clarify that and let the doctor know that we don't think the same thing?
Yeah, the officer doesn't stay there.
Not.
That's where Reach for Home can partner.
Yeah,
Because we can stay there, because you guys can't, you can't just sit around a hospital.
Yeah, you've got to hurry.
just so you know, we get a lot of flack from like Hillsburg Hospital, because when we drop person off with 5150, they get upset. So what are we gonna do? And we have months and months and months. You're the closest hospital, you're required to take them. They're coming here.
Yeah, they shouldn't be able to keep passing the buck back on you like that.
Yeah, and then, we used to take them down to Sutter, and then Sutter got mad at us for, okay, you're passing Hillsburg. So we started going to Hillsburg, and we're just, they were firing back at us.
I wonder if we can talk to somebody like a head administrator at Hillsburg and say, hey, we need your help. You can't
I
just.
think
toss
the
it back.
root of the problem is that it's not a hospital issue either. So it's like
Right.
you've got 2 people who
There's nowhere.
you're not a behavioral health system, and nor is the hospital. So both are like working with a failed system to try to mitigate their issues, right? It's not an ER issue either. And so really where the big problem is the access to behavioral health within the county. And that's what we're working on at the Continuum of Care Board, but there's just not enough beds. There's not enough staff. Access won't come up here. Like, they don't come to Hillsburg. They barely go to Windsor. So And then if you answer questions wrong, like, because they're so understaffed, they just, well, they didn't answer there, they don't qualify. So, from a systems level, that's where we're trying to fix the problem, because it's, you know, ER is not the answer either, nor is the police, nor is
Has anyone brought this up as our supervisor?
ad nauseum. Yeah, actually, yeah. And actually, our supervisor Gore has been pretty good at trying to help. We had someone who was like the people we're talking about in Healdsburg 2 years ago, and they just bounced him out again after, you know, like probably 10 or 15 5150s, and he got involved, and that's how I got, not me personally, but like Reach for Home kind of got more of the contacts for the crisis stabilization unit and stuff. And that's when we started realizing like we really have to plug into this system that's broken. And we're gonna have to start, that was when we made the shift where we're not leaving the hospital. As long as we can stay there with someone who's been 5150, we will stay and advocate with them. And we have, you know, contacts now that we can kind of use, but if there isn't a bed, they're like, there isn't a bed. So it's still not perfect, but yeah, I think he's definitely aware of the brokenness of it, but yes, we need to keep on him.
They did the same thing with
Sure.
the female that we brought up there.
Yes.
Is, well, she's on our med now, she doesn't meet the criteria.
Right.
Yeah.
Yeah, but how long does that last? You know what I mean?
Yeah.
They need to create places for these people to go and like get stabilized and get nurtured for a week.
So there are more beds coming through something called bridge housing. And they're supposed to be opening, I believe, in June, by June.
Where's that at?
It's in Santa Rosa. It's an old, oh my goodness. I can look it up and let you know. It's an old place that they're refurbishing. And basically it's not just for unsheltered people. That's the other problem, is behavioral health for everybody, not just unsheltered people. So,
Is that the old one up on Sinead Road?
it might be,
I think that's the old VA hospital up there from years
it might be,
back.
there's several beds.
I know they were talking about, there's a lot of beds, that they can rehab that, that'd be.
And it's for people like what we're talking about. So
Marin
I'm
has that,
really
like they
hoping-
have crisis houses.
And part of those beds will be for Marin, so we're sharing with them back, like they shared with us, so we're sharing with them, they have so many beds. And I can get you more information on it, but hopefully it'll at least help a couple people. I mean, we're talking, you know, however many beds, 30 or 40 for the entire county, which.
And especially when you're sharing with
A
Marin,
huge
that
shortage.
cuts it down.
Mhm.
It's crazy.
Yeah, but there are beds coming, which is better than no beds coming,
Yeah.
right? I mean,
Yeah.
I don't know how they're gonna staff it. 'Cause there's no-
And when you say beds, Margaret, these are spaces for these individuals who, unsheltered come in, and some may not be unsheltered, but are having maybe mental crisis, to be able to kind of stabilize.
Mhm, and it's a little bit of a longer term, from what I understand. It's not just crisis stabilization, but it's like a bridge to permanent supportive housing, from what I gather of it. It's a program where people can come in, get stabilized, get 24-hour care until they are back up on their feet, stabilized on their medications. And then the goal, I think, from there is to get them a permanent housing solution. So they're kind of bridging, which is, you know, something we haven't really had in the county before, or we did, but I think it all closed and now it's coming back, so
My friend is a counselor at one of those. places.
Nice. it's much needed.
So, Chief, to, Vice Chair Wheeler's comment for members of the public who encounter unsheltered individual, who may or may not be in crisis, can call the Cloverdale Police Department, call 894-215-2150. Which are non-emergency line, report the individual. What kind of information would be valuable?
What are they observing? Why is this, why do you feel they're in crisis, or do they need assistance? And that'll help us direct if we reach for homes or something else. So we can get resources to them. And or an officer out there to evaluate.
Chief, what's the name of the guy who walks around a lot, who's, just walks right into the street and, you know him?
I do.
I do.
We both know.
Yeah, that's
Call him Slow Walker.
Yeah,
Slow walk, is that the dude, is that the slow walker guy?
yeah.
Okay.
And what's his stat? Are we not supposed to be talking about individuals like this?
Also, I don't know what chiefs, I don't know what your criteria is. We kind of have privacy, like
Yeah.
privacy and it's a public meeting, but
Okay.
I don't know.
Yeah, you're right, but we're aware.
We're all aware and we're all trying to help. Probably everyone you're doing right now is on the list.
Yeah, sometimes he's a little, he gets a little, a little upset with us. Sometimes he doesn't.
Pouring rain, just walking it up.
Hey, and Margaret, what's the best number for reach for home, like,
Yeah, 707
okay,
433
okay,
6161. Just for the general public, and for city council and whatnot, you should all have my personal number and just text me. That's the best way. If there's, if we're collaborating on somebody, like, but if it's just for general public, that's the number. A lot of times we're out in the field and we're not, sitting at the phone. So just leave a message and our ops manager will field it out to who the message needs to get to.
Okay. Is it, what is his name, Mark? Is it Mark that comes up here?
We have, Rick, who
Rick.
lives up here. And then, Patty has been going with him, our licensed clinical social worker, because the people that we're talking about, that's really what they need.
Yeah. Yeah, Rick does a good job.
Well, thank you.
So moving right along, ED discussion update on 2024 point in time count.
Thank you, Madam Chair. Just a brief update. Sonoma County just recently conducted the annual 2024 homelessness point in time count for all the individuals in Sonoma County experiencing homelessness. It is typically conducted on one day. This year it was held on Friday, January 26th. And that's pretty consistent year after year. It's kind of late January, maybe sometimes early February. The county coordinated 5 deployment sites for the counters. They were, kind of broken down northwest county, Sonoma Valley, Petaluma, Santa Rosa. Ultimately, the count data will be tabulated by a research survey firm that the Sonoma County Community Commission hires, and the commission will release a report in about 4 to 6 months. Sometimes we'll get kind of the preliminary results before maybe the formal report comes out. At this time, I unfortunately don't have any data to share with the subcommittee on what it looked like this year as compared to last year. Last year, we witnessed a very significant reduction. I think we were about 22 individuals. But maybe Margaret, if you want to talk a little bit about maybe what you saw and numbers,
Yeah.
trends, if they're up or down.
Cloverdale seems pretty stable. I actually did the count here in Cloverdale and the whole area on Geysers Road and all of that. And I did it last year too. So this is actually, I've done it 3 years in a row. I've been assigned to Cloverdale. So I would say that it's fairly stable. I don't know that we're going to see the huge drop we saw last year to this year. I don't think we're going to see a huge increase either. I think it's these individuals we're talking about that are a little harder to serve, that it's going to take a little longer to get them what they need. We didn't notice a lot of new people necessarily. They're people that have left to get help and then come back. They're kind of the people that just kind of keep reappearing off and on because they just haven't found their permanent solution yet, is my assessment from what I've seen. And I don't know if that's kind of in line with what you guys are seeing at the police department. But that's kind of what I saw. So we had and I don't know where the county lines are versus the city lines. And so the way that the point in time count is done and the way it's been done for about the last 3 years is now we have an app on a phone with geolocating. So it's pretty precise as to whether you're county or city. Before that, we didn't have, it was a volunteer going out and trying to decide, oh, is this the line for the county or the city, like where those lines kind of start to blur. So the count should be a little more accurate over the last, especially 2 to 3 years, as far as county versus city, because the map should know better than I would where that line is. So I don't know who was where, but total between the county and, the city before they do their weird algorithm where they, sometimes, there's the way that they crunch the data is we were around 20 to 30 is what but that's for all, the whole kind of area, counting Geysers Road, out in the county, in Cloverdale, that whole thing. So I don't know how it'll shake out for city, because I don't know when the lines are as good as. But that's kind of what I saw.
It's about 30.
Yeah,
Okay.
yeah,
Is that
between
the-
both, for the whole entire area, all the way up to Geysers. And it sounded right to us. I
Yeah.
mean, based on our findings list that we have we have the names of almost everybody, and then we know there's some trailers that just won't talk out on Geysers. They just kind of shut in, and it seems about what we
Yeah, it
expected.
seems about right.
It didn't seem like, we weren't surprised by it being too low or too high. So we'll see what their official count comes back at.
Madam Chair, that concludes kind of staff's just update on the point in time count. And
Okay,
we'll just continue to track where the county is and, finalizing the report and bring that back for your review as soon as it's available, or any updates that are provided through the county. But we just wanted to, at least just report out on, that the count happened and, what we kind of expect to see in terms of numbers. It sounds like it's gonna be, not all that different than what was reported last year, but we won't see the big reductions from the previous year like we saw. Some of that might be because of we haven't had a big change in, activities elsewhere, fires and things like that, but we'll certainly keep this committee updated as we learn more.
okay, so moving on to F, standing items. So FA is update from Cloverdale Police Department. I don't know if you have anything else you'd like to add, or if you've covered it.
Give me that word. No. No, I don't have anything else there.
Okay, so FB, update Sonoma County Sheriff's Department.
Yeah, I think usually we will have a report out by Lieutenant Duke in the Sonoma County Sheriff's Office. He's kind of the lead contact for the service area for the sheriff's office in northern Sonoma County. I don't know, Reach for Home, if you have a different person you work with in Healdsburg, or is it tend to be
It's
Lieutenant Duke?
Lieutenant Duke,
Okay.
yeah, when we work with them. Gotcha.
What I understand is that a lot of their work has been focused on enforcement of no trespass rules on private property, and some coordination with the county. But I think it's an area that there's maybe a little bit of frustration, given some of the encampments, particularly down in the Healdsburg area, and how are they addressing some of those no trespass actions. But other than that, I don't have much to report. We do contact or have contact with Mr. Duke from time to time. And I don't know, Chief, you interact with them for any collaboration that you do along the river or river park.
We're working on it. Not often, but I think I saw him last month. He's here.
So FC, update from the Cloverdale Fire District.
Yeah, so probably the most significant reason why the Cloverdale Fire District is an integral member of this group is because in the past, some of the encampment activity has, along with that, it's been an increase in fire activity. And sometimes the mitigating actions require kind of us all working together. We've been making a lot of progress as a region in terms of the vegetation management activities, which, you know, one of the primary purposes to reduce our wildfire threats, of course, but it's also helped, I think, particularly at the Cloverdale River Park, like
It's been huge down there on the river. It's,
Right.
oh, yeah.
keeping the vegetation down. It reduces the fire threat, but it also keeps some of the areas more visible to the public and tends to maybe inhibit some of the, you know, growth in encampments. And so we really do see a kind of a key partnership with in between you know, our homeless efforts, but also the Cloverdale Fire District. And you know, they're obviously, if there is a fire in encampment, they're the ones that get called and respond. And so it's other than that, I don't have more to report on. I just want to say we just continue to work with them on a lot of our veg management activities.
So FD, update from the Sonoma County Continuum of Care.
Well, we're lucky to have Margaret with us today. Margaret serves as the Northern Sonoma County appointee to the Sonoma County Continuum of Care. And the Continuum of Care Board, one of their most significant roles, in my opinion, is that they oversee kind of the planning for homelessness on the county scale, but also the funding. And the funding is so critical, obviously, to being able to provide the homeless services that are offered. And I know Margaret was selected in part because of her role with Reach for Home as one of our few service providers or in outreach services within Northern Sonoma County, but also because of the good work that you're doing in advocating for change in the system, to be better at you know, improving our performance relative to our shelter population. So I don't know, Margaret, you want to maybe talk a little bit about what the Continuum of Care Board is up to?
Sure, no problem. So the first thing is that there was a name change. We're now the Sonoma County Homeless Coalition. To better kind of align with what our work is. Continuum of care, I think people are like, what does that mean? You know, because you can have a continuum of care in a lot of different venues. So that's the new name. So if you hear that, that's the same with the Continuum of Care Board. Nothing's changed, we just changed the name. So the things that the Continuum of Care Board is working on right now is the CE prioritization. So coordinated entry is the system, the countywide system that's used when an unsheltered individual needs housing and they get entered into that system. Reach for Home is an access point for that for Northern Sonoma County. I believe Alexander Valley also might do coordinated entry there. But we're re-looking at when someone goes into that system, you know, how are they being prioritized? What's being taken into account, and how are they kind of being scored and prioritized in that program? So we're just overhauling it. There's a whole committee working on it as a subsidiary of the Homeless Coalition. Right now, the feedback from kind of the recommendations were sent to the entire provider group that we have in Sonoma County for feedback and to just give, you know, does it sound like they're going in the right direction? What's the feedback from it? And then they're going to take that and kind of keep moving it through the system to get it approved. But we're hoping that with the new prioritization, the people who need the housing most will be the people that are kind of coming to the top. The other thing that we've been working on countywide is the notion of sub-regionalized street outreach. So just looking at each region, so Northern Sonoma County, Southern, West, you know, all the regions have a coordinated outreach effort for that region. So in Northern Sonoma County, Reach for Home is running the sub-regionalized effort. And what that also means is that we have sub-regionalized what we call by names lists. So it's a list, internally, we have it on a spreadsheet. We also have it countywide in the system. We're working on uploading everyone who's on our list into the county list. And so one person kind of helps manage that list for the region. So if anyone else, like a hospital or police department or anything like that runs into someone who's maybe unsheltered, who's not currently on our list, we would work with them to get them on the list and make sure that we're case managing them. So we've really shifted over the last 3 years from being a survival mechanism where we give food and clothes, and we still do that, tents, tarps, but really looking at what is the housing plan for this individual. And not everyone's ready for that yet, but what's the first step they can take? Well, usually it's, can you get into coordinated entry? So we were actually just up here doing some more coordinated entries because what they refer to as the hole, I think that might be Shamrock, that was just cleared. So we were able to help get some of those people into coordinated entry. So anyway, as a system, we're looking at taking it and making it more bite-sized, which we've already been doing here in Northern Sonoma County for quite some time. So this really is no change for us. It's just taking the best practices that we've had and, you know, kind of now it's countywide and they're doing it the same way we are. And so that's kind of exciting. And it's not because of us, it just was serendipitous, but it works. And we're just really excited to see the whole county kind of go in that direction. This was the first year, the point in time count, where we could really see that the numbers are sort of matching. You know, who we have on our list is who we count, you know, who we had on the count. There weren't any, you know, real surprises. So it's just a better way to kind of help people one at a time versus the blanket approach. So that's happening countywide. The other thing countywide is they're going through their NOFA process. So all of the service providers, some cities applied for funding and they're looking at all of those applications. They're going through the funding and evaluation committee and getting scored. And so some really big funding decisions will be announced in the next couple of months for, you know, various people who put into that notification of funding availability they had out. And then also the one thing we're working on countywide is access to behavioral health. How can we have a better flow of referral to behavioral health? Oftentimes we get referrals from them, but like, how can we get them where we really need to give them referrals? And so how can we do that better? And what does that look like? And that's one of the things because of what we're seeing in Cloverdale, specifically, and some in Healdsburg. That's why that's a huge thing for me and what I'm trying to advocate for Northern Sonoma County is just we have to get better with getting the people help that they need. Yeah, which we've already talked about. The focus primarily with the Homeless Coalition right now is chronically homeless individuals. So those are the individuals who have been unsheltered for at least a year and they have some sort of a disability, mental health or physical. Usually it's a dual diagnosis with an addiction, as we all know. And so that's really the focus. And I would say that probably 95 to 100% of the unsheltered population in Cloverdale, Windsor, and Healdsburg are all chronically homeless. So the fact that they're focusing on this actually behooves us because that's pretty much our entire population of unsheltered people. And that means that a lot of the funding that they're giving is to go to help chronically homeless individuals. And so that's pretty much my update.
I have a question. Is coordinated entry still using Housing First?
They are. We're an entire housing first system.
And Margaret, kind of on that point, I know in speaking with Councilmember Morris, you know, there's probably some interest in council members, you know, kind of understanding, you know, how cities can be advocates for overhauling or improving the system and you know, is there kind of, what would you see if, for say, a chair wanted to get involved? How might she be able to do that, or vice chair?
I mean, I think that what we spoke about before, in just making sure that Supervisor Gore continues to understand the enormity of the situation with behavioral health. I mean, or anything, but I mean, I think that's really it's probably the biggest thing is.
I don't know. I think there's more to it. I was homeless for years and the system failed me. Coordinated entry, I could tell you all kinds of things about them that are really not okay. And Housing First is unfair. Like, unless you're like pregnant or just got out of prison or the crazy person at the bus stop, you could rot forever before they even pretend to look for anything for you, so.
Right.
I mean, I've seen the homelessness thing in person and the whole homeless shelter thing in Marin's.
Right.
And I really think there needs to be change for everybody, not just the people that are in desperate need, you know, sleeping in the bushes.
Definitely, yeah, and I think,
Especially seniors.
right, well, I would love to get your feedback if you had time and wanted to,
Oh, yeah.
on the new prioritization that we're looking at and everything, because I feel like you have great insight into that. That system should help, you know, with people who are homeless in general. And then the access to behavioral health is the thing that we need for the people that are, you know, they're not going to be independently housed. And so why would you take them first off the list of people in an independent housing situation that they're gonna fail at? Like, that doesn't make sense.
I've seen that happen.
Yeah, so we're trying to come up with a system that makes sense for each individual and have different paths for what each person needs. Like, going back to that, it's not a blanket approach, and you're exactly right. I mean, yeah, so if you would like to.
Yeah, no, I'd
input
love
into
to.
it, that'd be
I mean, I
great.
really want to get involved in it because I've seen the whole system inside and out, know like way more than most people know who are like, you know, or,
Yeah.
yeah.
We could talk offline there. I'm already like, ooh, I have some ideas. So.
Yeah.
I think that would be great. Well, thanks for that. I mean, you talked about the coordinated entry improvements, overhauling the system, the implementation of the sub-regional street outreach. We saw the announcement from the county that we're trying to expand those services.
Mhm.
Obviously being an advocate to improve access to behavioral health. And then kind of this new, maybe it's not new, but re-emphasize focus on chronic homelessness.
So let's see, FE, I guess we covered that.
That's me.
Yeah.
The only other update I would say that's not countywide and it is just Reach for Home focused, would be that, we did, and this might go into the sheriff update, with the no trespassing that you're talking about. Reach for Home did receive, in partnership with the county, a $2.7 million grant to help clear the private property areas and subsequent property around that, of the Russian River area, in Healdsburg. So it's that SIR property that now Volcon's leasing part of it, but it goes just north of Healdsburg and south of Healdsburg. And why is this important to Cloverdale? Well, it also allowed us to buy and purchase a home with 6 additional units, and it's located in Windsor. We have a lot of housing in Cloverdale, like, I'd say more housing in Cloverdale than anywhere. We have a decent amount of housing, and none of it's enough, by the way. When I say decent, I don't mean like we have enough, but don't be fooled.
Yeah.
But we have a decent amount in Healdsburg, but we didn't really have any housing in Windsor, which some people prefer because it is closer to services. They don't want to move out of northern Sonoma County, but it's, you know, a little easier to get to Santa Rosa than Cloverdale is. So we purchased the house in January. And we're gonna start leveraging that house hopefully in the next couple of weeks here. We're looking at making sure that we're fully staffed from a case manager position so that once people move in, we'll have the case management wraparound services needed. The house is a part of the SIR grant, but it's not, and it doesn't necessarily mean that someone's going to go directly from the SIR river bed over to the house. It's a part of the system. So it will benefit people who are unsheltered in Cloverdale as well. The rest of the money, aside from purchasing the home, we have someone who has now been embedded in our program from the county. He's a part of the HEART team. And he is alcohol and other drugs certified counselor. So it's allowing us to have access to that service as well. He was already at the L&M once a week, but now he's expanding because of this grant to help, particularly with people on the river, but he is a part of our team and has been helping people up here in Cloverdale as well. And then us being able to hire the licensed clinical social worker from some private funding and also some funding through SIR, through the grant that I'm talking about. She has already been up here and has been trying to work with people we've mentioned previously. And she has a little more of an access point with the county. So we're trying to get people kind of through that hurdle Alliance Healthcare, has also been partnering with us and partnering with people up here in Cloverdale as well. We have a relationship we're starting with them where we have immediate, probably within a day to 2 day access to a doctor there who has completely opened himself up to take anybody who comes to reach for home if needed. And that includes people who are maybe not quite 5150, but maybe we know that like they need to get into the system somehow. We can make them an appointment with Dr. Pace there, and he can get them referred through their AOD counselor and through their mental health professional to start being seen, and then they can get connected to the county if need be. So we're trying to we can't fix the broken system ourselves, but we can find a way to work together to kind of get through it and around it. And so that's what we've been working on.
That's
What day does, I'm sorry, what day does Rick and the social worker come up?
They're always here Tuesdays,
Tuesdays.
but then a lot of times they're here either Thursday or Friday. You know, they always do another day too, but Tuesdays is their definite day.
Tuesday.
They go to Living Water Church.
Okay. At Living Water Church.
Yeah, and they also go out to the
Yeah.
camps as well. And they're not in the van as much anymore because we actually needed the van for the L&M, so they're in private unmarked vehicles, so that's why you're not like seeing them
Yeah,
here.
yeah, we used to see the van all the time.
Mhm.
But that's.
Do they have like sleeping bags and things? Okay.
They do, yeah, they have all the stuff that anyone would need to make sure that they're safe. That's great.
And Margaret, in terms of reach for home, maybe just real briefly, provide an overview of your role with the L&M and your partnership with City of Healdsburg. Just and I know I think I've seen correspondence. This is that there are beds available there for Cloverdale homeless.
Oh, yeah.
And maybe kind of elaborate on that.
Yeah, so it was a Project Homekey funded site, so we were able to open a year ago in November and slowly were able to get to full occupancy. But it's for all of Northern Sonoma County, and it is a Northern Sonoma County program. So people can't just come from anywhere and get into the L&M. You have to have been unsheltered in Northern Sonoma County. We have to know you, you have to be on our running list. And that includes all the Cloverdale individuals, some of which we've talked about today have actually been at the L&M. So it's a 6-month program, but it's a 30-day program, but you can stay there up to 6 months. So we have a 30-day, it's an interim housing program. It's non-congregate shelter. So people get their own room, their own bathroom, and their little, refrigerator, microwave. So they're self-sufficient. So it's not just cots in a big room, which is I think during COVID, everyone started to realize, oh, maybe that's not a good idea. It's a part of the solution and it's needed, but it's not as big of a stepping stone as someone being able to learn how to live in their own kind of little space. It's very much like an apartment. If people are there 6 months and they're working on their housing goals and there still isn't housing available, they won't lose their housing at the L&M. Our goal is to get them into more permanent housing. We've had 17 people since we've opened get into more permanent housing, and we have served, I believe we're up to 52 people since we opened just a little over a year ago. And some of those people are still there. Another part of it is that, and this is why we really value the work of the licensed clinical social worker, is that we have had several people who have come in and, within the first month or so, their behavior might change because they're feeling safe. And so that behavior might not be behavior that we can unfortunately have at the L&M because it isn't safe, even though they're feeling safe to have the behavior, it's not safe to the other people at the L&M. So, and I get asked this a lot, which is why I'm expanding on it. We will ask them to leave sometimes for 2 weeks, sometimes 3 weeks, sometimes a week. It just kind of depends. But a part of that and caveat is that there's a warm handoff back to Rick or back to Brianna, our other street outreach worker, case manager. And then they also still can meet with their housing case manager, and where we encourage them to work with the licensed clinical social worker to get back in, and we will hold their room until they're safe to come back. There's only been 1 or 2 times where it's been violent, where we're just like, unfortunately, it's an automatic exit. So a lot of people ask, if someone's behavior is not good, what do you do? How do you handle that? That's kind of how we're handling it, is we're really trying to encourage people to take that break, reevaluate where they are with their journey, and work with our licensed clinical social worker and our case managers to get back in. And if they're not ready yet, that's okay. Like, we're still here and they can go back on the list and eventually get back in, when they're ready.
And is there opportunity for, like, if either Councilmember Morgenstern or Vice Mayor Wheeler wanted to, let's say, visit, Live Water Church on Tuesday, or come visit the L&M? I mean,
Yeah.
we just coordinate directly with you.
Definitely.
Okay.
Yeah, we'd love to have you for a tour at the L&M for sure. Yeah. That would be great.
Let's see, are we on FM?
I'm sorry, I have one other update and I wouldn't interrupt, but I feel like it's a good
No, that's
update
fine.
because I think Cloverdale is gonna benefit a lot from this as well. And the CTAC meeting that's coming up, we were denied funding for this, and I don't know who the CTAC representative is, but this week, it's Wednesday, you're gonna have the chance to, they're going to present the funding for the notifications of funding that they had. And we did not receive we're not being recommended for the funding. However, at the CTAC meeting, that can change. So our next step in this, because we've launched our journey to zero, which is basically by the end of 2026, we want to be functional zero in Sonoma County, and we're making progress on that. But as we become functional zero, which means homelessness is rare and brief, we're not going to end homelessness. It's going to be there. But for the most part, if someone becomes unsheltered, it should be very rare and brief. Brief is the key word for us. 30 days, they should have some sort of a solution to scoop them up and help them get the services they need. The longer you're unsheltered, the harder it is to become sheltered. And so as a part of that, our next step is we need a really good, robust eviction, diversion, homeless prevention program. We've always had one. But it's been very underfunded. It hasn't been case managed. We haven't had a case manager in it. We have utility assistance and rental assistance. But what we've really seen in the work we're doing is that's great, but then what? So here's okay, so you're not being evicted this month. Here's your handout, right? Handout. But what got them there? Why are they a month behind? Why are they 3 months behind? What's causing that? So we were able to get some private funding from Providence to start kind of dabbling in case management and mental health support for people who fit the criteria, which we're still developing, which I would love your input on. I feel like you would be helpful here. What are the indicators that this person could become unsheltered? They're housed now, but they're getting evicted. Yes, we have utility support. Yes, we have rental assistance. But we also are going to now have a case manager who can come and sit and talk and say, how did you get it? Maybe it is they just lost their job and that's fine, right? But is it hoarding? Is it that they have an addiction problem? Is it that they, had this whole thing happen and now they're all the way over here and by themselves, they're not going to make it back up. And then we have our licensed clinical social worker who can help connect them with mental health support. So it's looking at the whole person while they're still housed and keeping them from becoming homeless. And so it's sort of a pilot program. I don't know that there's anyone else who's doing this holistically in the county right now. But that's what we're doing. The county in general is piloting a utility and rental assistance homeless prevention program. That's separate. We're kind of one-upping it and trying to see if we can kind of get more support to people. And so anyway, thank you for allowing me to share. But we were trying to get the funding through the CTAC notification of funding and we weren't approved. So
What was the funding request amount?
maybe 90-something thousand for a full-on 1 whole year of mental health case management, an entire eviction diversion program. I can tell you the amount before Wednesday. That's off the top of my head. I feel like it was around there.
I mean, maybe there's opportunity for you to coordinate, because Kevin's the city
Mhm.
representative on the CTAC. For the, particularly for the CDBG funding for city projects.
Right.
But also as a participant, I think I vote on the board that oversees the funding for homelessness as well, right, Kevin? And then
Yeah,
it's, it would be an opportunity to advocate for that funding.
Mhm.
And I assume you're gonna be there at the
I will
meeting.
definitely be there the 14th. They
Yeah.
said that things can change. I'm like, okay, well, and we also have some private funding that we're going off after also. So, but this would really help. I mean, it would be, even partial funding would help. So, and I think that that's really where we are right now is Northern Sonoma County. I mean, we have kind of this plan with the SIRE money, and if we can get some more behavioral health referrals, there's also a private investor that I know that's willing to maybe buy some land and put some more permanent housing. So anyway, this is kind of the next step. We just need to keep people from becoming sheltered, right?
This is more of focused on homeless prevention and rather than homeless response, because you're
Well,
trying to.
it's, yes, but also, as we house people who were formerly unsheltered, we also need a system that's gonna keep them housed too. So it's keeping people who have maybe never been unsheltered housed, but also helping those who were unsheltered stay housed. So it's sort of both, but the commonality is they have housing, yeah. Mhm.
Well, yeah, I would, if you have any speaking points that you can send to by way of email,
Yeah,
both to Kevin and myself, and Kevin's on the committee, I'm not, but, we can certainly, I can see that this is in line, it sounds like it's in line with our homelessness master plan, which I know you were a part of.
Mhm.
And if we can point to that, I would be able to speak and advocate, for funding for it, and, zoom in and say. If that opportunity presents
I would
itself, so.
definitely send some bullet points.
It's super important.
That we think so. I mean, yeah.
Well, it's like Brian was telling me the other day what the Coast Guard does when somebody jumps off the bridge. It's like they immediately know what they're doing. They just put it into effect. And I would like that to be the case for Cloverdale. Like if there's a family or just one person renter that's in a dangerous position where they could get evicted, I would love it if somehow we had this well-oiled system where we knew how to go in there and help them and prevent it. Because people becoming homeless, it's not gonna help them or the city or the citizens, anybody else, and it's costly, so.
Yeah.
So if we had a plan in place where we knew exactly what to do, that would be great.
Yeah. Yes, I'm excited about it, actually.
So let's see, are we on FF?
We are in FF.
County of Sonoma.
I don't have any updates from them, other than I did see they issued a NOFA that I think proposals were due on January 22nd. This was for local homelessness services.
That was the one I spoke about as a part of the continuum of care update.
Okay.
Mhm. So that's all going through evaluation right now. They are, all the applications are loaded, I believe, publicly. You can log in and see who applied and what for, and we applied for 4 different NOFAs, I believe, for Northern Sonoma County. One was Wallace House to continue funding there for case management, street outreach, permanent supportive housing, and rapid rehousing were the 4. And we tried eviction diversion too, but we were told that they're not gonna probably be funding it because they're centralizing all of it. So,
I have a question that might not even be on the county, but did you ever talk to Downtown Streets team to see if they could come up here, or you haven't had a chance to?
we have talked to them a little bit, but they were really focused on getting their up and running down in Petaluma, I believe is where they
Sure.
were.
Yeah.
But yeah, I can
Maybe
readjust that.
eventually.
Mhm.
And then I have another question too, reach for home houses people, but, and then they stay there until they can find permanent housing. Is there any sort of, education that people receive while they're waiting for housing, like in Marin, like when people are in shelters, they can go learn how to be like a chef, there's a school. So that way they can get a job, you know, and work in a restaurant or cater. Or whatever.
Yeah, so while they're at the L&M in our interim housing program or at Wallace House, we have case managers that can connect them to job training. We don't have anything as formalized because Northern Sonoma County is so disconnected. There are programs like the chef program down in Santa Rosa, and we're trying to figure out how to partner with them. But the hard thing is getting people to even do 10 hours a week somewhere here, you know, is like the first baby step. And so to get them to get in a car and go all the way to a program that's down in Santa Rosa, we don't have enough up here in Northern Sonoma County.
Sure.
We also had partnership with Hansel Subaru and Hansel BMW, where Hansel's willing to hire people that we send their way. But again, it's just super far. And so even getting on a bus from Cloverdale to there, it's like an hour and a half with a 3-mile walk. I mean, it's ridiculous. So maybe when the smart train gets up, like we'll have more open opportunities for people, but we definitely look for that sort of thing. It's just a one-off because we have to take each person and find where they connect because there's not like a big program.
And not every person's meant to be a cook or a chef.
Exactly, yeah. And we have mentoring program as a part of the L&M where they can help. We have little stipends we give people for training and whatnot.
So let's see, I guess we're on FG now.
No other.
And then, G, future agenda items, and then I had a, item that I wanted to discuss.
Thank you.
And it is having, attorney come up from legal aid. And she specializes in stabilizing housing policies. Her name's Margaret D. Mateo. And she's perfectly willing to come up and do a presentation in person or do one by Zoom. And she did a presentation already for the Sebastopol City Council. And the reason I would like her to come talk to us is so that we can figure out ways to keep renters in their homes longer so they do not become homeless. And she was hoping, and I was hoping that we could plan a meeting way sooner than June, you know, like maybe a special meeting, so that we could start finding out what she has to teach us so we can start implementing it way before June. So I was hoping maybe we could have a special meeting within the next month or within a month. So we could,
Her contact or what her.
oh, I have all her
Is.
contact. Yeah, and she's perfectly willing to help us. She'd like to.
Well, how about this, Chair, if you share with me her contact information, or if you want to contact her directly, we could identify some dates. And then I'll coordinate with both you and Vice Mayor on your availability, and we could do you know, to see if we can schedule a special meeting.
Monday's a good day for me, and plus Margaret might want to attend because I'm sure.
Oh,
you know,
yeah, it
it'd be-
sounds like a great topic.
Yeah, and she wants to talk to us about, she knows certain stats, like how many people have been evicted in Cloverdale, how many times the sheriff has come thrown them out, you know, those sort of things. And what she really wants to do is help us figure out how to stop people from being evicted.
Yeah, that sounds like perfect timing for us. We're ready for that.
Yep.
Thank you.
So, does anyone have anything to add before we close the meeting? So it's 2:33 and the meeting is closed.